Hello, my name is Marjorie Allen. I'd like to take a few moments of your time to discuss medication errors. You will learn about medication errors in your RN to BSN program at the University of Mount Olive during your Nursing 330 course titled Law and Ethics for Healthcare Professionals. This particular video is an assignment for my MSN degree at the University of Mount Olive. During this 5-minute video, I will use some principles of the adult learning theorist Albert Bandura and his social learning theory, specifically using the central concept of his theory, role modeling. I have one overall goal, and that goal is for the RN to BSN nursing student not to make this particular type of medication errors after watching this 5-minute video, to help them become more aware of ways to prevent this medication error from happening. I have 3 objectives. Objective number 1 is after watching this video, the RN to BSN student will be able to name the 5 rights of medication administration. Objective number 2, after watching this video, the RN to BSN student will list at least 2 specific ways to prevent this particular medication error from happening. And objective number 3, after watching this video, the RN to BSN student nurse will use the proper procedure for reporting a medication error. There are many different types of medication errors and many different ways to commit a medication error. One specific way is to use the 5 rights of medication error, 5 rights of medication administration to help prevent a medication error. That's the right patient, the right dose, the right drug, the right route, and the right time. The 5 rights of medication administration. And hopefully if you use this, that will help you to prevent a medication error from happening in the first place. A great example of a medication error is not activating the medication mini bag. This particular antibiotic comes in a bag that has a plug. You pull the plug, activate the powder that's in there. And this particular type of medication error was happening very frequently at the facility where I work, so they took some strategies to help prevent this medication error from happening. One strategy was they placed a hot pink sticker on the bag to help remind the nurse to activate the medication before spiking the bag and hanging it. Another strategy they used was they created a CBL, computer-based learning, to help discuss with the nurses stop times, where the nurse is to go back into the MAR and document the actual time the medication stopped infusing to help ensure that the patient received the entire dose of medication. A third way to help prevent this medication error from happening is to create a routine, some way that you always know that you are doing something to prevent this medication error from happening. One way I instruct people that I precept is to not spike the bag until after they're sure that the medication has been activated and shook up. That's one way to prevent this medication error from happening. So whether you're the nurse who forgot to pull the plug or you're the nurse who came in after the nurse who forgot to pull the plug, now you've found a medication error, so what do? You have to report it. You should be familiar with your nurse's, your hospital's policy and procedure for reporting a medication error. Most hospitals, you have to notify the physician that the patient did not receive this particular dose of medicine and what they want to change, if not change anything. Then you need to report this. At our hospital, we use what's called a quality risk management form, which is on the computer. We fill it out. It describes exactly what the medication error was. Was there any adverse patient outcomes that happened in it? And this email is then sent to directors, supervisors, and administration so they can help prevent ways for this medication error to not happen again. So we have gone over the 3 objectives. In conclusion, we have been able to discuss the 5 rights of medication administration. We've listed several different ways to prevent this particular medication error from happening, and then we've discussed what you need to do once you have discovered a medication error and how to report it. So therefore, we've reached the goal that every nurse that's watched this will hopefully not prevent this particular type of medication error. So this lecture was supported by evidence from our textbook, Nurse as Educator, and also from the Wayne UNC Healthcare Policy and Procedures on Medication Errors. So be familiar with your medication error policy and procedure, where it's located, and what to do if you find or commit a medication error. Thank you all for your attention, and you will be receiving a survey to please fill out, and if you would return that to Dr. Carolyn Robinson at Robinson at umo.edu within the next 3 days. I appreciate your time very much. Thank you.